Welcome again on behalf of Futuro McAllen, ladies and gentlemen. The first thing I'd like to do is recognize one of the people who was initially instrumental in getting this program started. Come on. This program came together with a brief conversation after the mayor's State of the City luncheon with a couple of administrators and school board members from here in McAllen, one of whom is Marco Saurez. And I'd like to recognize Marco to say a few words on behalf of McAllen School Board.
Thank you. On behalf of McAllen ISD Board of Trustees, Rowe High School for hosting the event, and Futuro McAllen, thank you very much for being here today. This started off as a concern, then we talked about it, and the initial conversation was to get surrounding districts to come together and talk about the concerns that are in our community and how they're impacting our schools. And the Board of Trustees in McAllen were very supportive. And those that are here right now, I'd really like to recognize is Mr. Tony Fodina, Mr. Danny Vela, Mr. Sam Saldivar, our President Ito Alvarado, our Vice President Larry Esparza, who could not be here with us, and Mr. John Ball, who is on his way, he says. So thank you very much. But really the people that I'd really like to thank are two individuals from other school districts that the minute I called them and asked them for their support and if they'd be willing to do it, they said yes. And with that, I'd like to recognize Mrs. Melissa Smith from McAllen ISD, and Mr. Jaime Solis from Edinburgh ISD. And it was, when I say no questions asked, they said yes, and they're here. Finally, I end it with a conversation that I had with some school nurses, particularly here at Rowe. And I was asking them some of the concerns that they had or some of the issues they had. And in doing that, one nurse looked at me and said, Mr. Saurez, what are you going to do with all this information? And before I was able to answer the question, another nurse looked at her and said, he's going to save the shellfish. And that is why we are here today. Thank you very much for coming, and enjoy your evening.
Thank you, Marco. Let me quickly just introduce our panel. You all should have received on the way in a sheet that looks something like this, and on the back of that it has the bio for most of the folks on the panel. So I'm not going to spend a lot of time introducing them and telling you what their background is. You can read about that. But I do want to, I know for some of you towards the back it's a little hard to read the name tags. So starting with my far right, your far left, we have Representative Sergio Munoz. We have next to him Sheriff Eddie Guerra. We have the Director of the Hidalgo County Health Department, Mr. Eddie Olivares. And we have Chief Victor Rodriguez from the City of McAllen Police Department. In addition, joining them on our expert panel, we have Dr. Adrian Sandoval, who is a doctor of pharmacy and on the faculty of the UTRGV School of Medicine. We have Dr. Aaron Manusov, who is on the faculty of the School of Medicine. We have Dr. Ricardo Irizarry, who is with South Texas Behavioral Health and Tropical Texas. We have Mariana Resendez, who is the director of the Palmer Drug Abuse Program here in McAllen. And we have Adrian Garza, who runs the Family Treatment Program organization here in the McAllen ISD. So if you'd please give our panel a round of applause. With that, we're going to begin with some opening comments from Eddie Olivares and from Chief Rodriguez. So I'll turn it over to the Chief and to Eddie. Nedra has allotted the two of you combined 4 minutes, so you can arm wrestle over how you sort that out, but go ahead.
Okay, I'll take 3 minutes, all right? So is are we on with this mic or, okay, all right. Ladies and gentlemen, members of the panel, of both panels, on behalf of the city of McAllen and on behalf of the McAllen Police Department, we thank you all for being here today. We offer a special thanks to the parents in the audience. You're special for being here all the way around. We offer our thanks as well to MISD for hosting this event. I know that I saw the chief Esquivel in here. Thank him as well for his staffing this afternoon and helping us get around here today. Futuro McAllen, thank you again for hosting and putting this event together as well. Today's subject matter is the most recent substance of abuse amongst our kids. And we are here because this cycle of abuse is landing our kids in emergency rooms. I say this cycle because this is the latest, what I call in the evolution of substances of abuse. We have had other experiences. We went through glue, and I liken these because we're going to talk about what is spice and what is K2, whether they're legal or not legal. For example, glue, legal but abused. So that I mentioned glue, for example, the glue and the glue abuse. We went through spray paint, and that too, again, similarities in the fact that it's legal but abused, and some things that changed with that. LSD, we went through the LSD stamps, and I mentioned that because a lot of the things with spice and K2 is the marketing of that. LSD went into those funny stamps and Mickey Mouse stamps and all those kinds of, or some character stamps some years ago, again, for marketing purposes. Then we went through Rohypnol, which is a controlled substance, and the mixing of that with alcohol and so on. So there are many. There are many other substances that have come this way that are abused. The current substance is most commonly referred to as synthetic marijuana, and it's under brand names that include Spice and K2. That product or those products have many names, a long laundry list of names: Bliss, Genie, Black Mamba, Bombay Blue, to include some of those names. Now the allure to these drugs is multifold, often referred to as synthetic marijuana, and it is as if it were legal marijuana. The reality of this is that it's not marijuana at all. So that's why it's so important that we learn more about this today. Another attractive piece of it is that it's over-the-counter sold. It's how it's sold that may constitute a violation of law, but nonetheless over-the-counter available, and therefore the impression that it's legal and lawful and so on. It's cheap. It can be liquefied for vaping. It can be consumed as a tea. Now, over the day today, I think we'll talk about what is it and how we get it and what it really is, and but the bottom line is this: we've got plants and herbs that are being shipped into this country, sold in smoke shops, in vape shops, as a non-consumable product. Kids are buying these things and consuming it and getting the high from the chemicals that are being sprayed onto those plants and herbs. Now, legislation has gone several ways the last two sessions, always trying to meet these challenges at the door. But these are chemicals that simply the producers, and these are overseas, and they're coming from China and places beyond. They're just simply finding out what chemical is no longer on the list or not on the list, and then they spray that with that list and go on and go on. So it's almost defeating prospect that way. I hope that through today, the object of today is met, that is some familiarization, and I hope that we leave today with the hope in mind that we will learn together and save our kids. So with that, I'll pass it on to you.
Well, good evening, everyone. It's a tremendous honor to be here with such a distinguished panel. There's a lot of you that we've known each other since childhood in this room. We've known each other, we know our families. We've worked together professionally, and we've socialized.
Eddie, if I can interrupt you just a second. I've been asked to remind all of y'all to get a little bit closer to the mic so that people can hear a little more clearly.
How's that?
Perfect, thank you.
So, to me, it's an honor to be here with this panel. I guess for me, from the Hidalgo County Health and Human Services and my role, this is a public health threat to our community. And the way we got involved with this, actually there's two ways we got involved. The first way we got involved, we actually had a call from the University of Texas Rio Grande Valley Medical School and some of the residency programs. We had a case where there was, in fact, Dr. Austin's here. I gotta acknowledge Dr. Austin, where he called about a case that was extremely, lack of a better term, is bizarre. A very complicated, very clinically difficult case. There was all kinds of complications, all kinds of issues. We got the CDC involved. Had a big conference and got this doctor that's like the specialist in certain areas. The long and short, after all this is done and looked at, the final issue that came up that this person was addicted to spice. This person was addicted to this substance, but we had not seen a case so severe as this one and so mysterious from a clinical perspective. Our second partnership came up when Dr. Manusoff and I got together a few months back, and I said, you know, Doc, I'm getting calls and concerns about this substance. Can the University of Texas, Rio Grande Valley, their medical school, their health affairs college, can we work together on trying to get a message out? Dr. Manusoff, man, he was on it in a nanosecond, and he got his whole team on it. Because what had happened is that we started getting calls from the hospitals, and we work with the hospitals extremely closely. But we're getting calls for, they're having as many as 20 to 30 young people in their ER rooms every week. And they had no idea what to do. It was kidney dialysis was needed, ventilation was needed, ICU was needed, death was a result of it. So immediately when I started getting that information, I, along with our partners that are here at this table, got together. But my number one resource was this man right here. Sheriff Guerra was the first person I called when it came to deal with direct community intervention. He didn't even bat an eye. Immediately, he got his people on it. And then within a matter of weeks, Dr. Manusoff, the sheriff's office, the DA's office, we had our first large-scale event of over 300 people that attended the first event, it's almost coming up on a year. And quickly, this thing flew. And before we knew it, now we have this. McAllen School District sponsoring this, Sherryland being part of it, Edinburgh being part of it. We have the superintendent here from Mission, all these other school partners. I mean, I see my friend Chief Dominguez over from Mission. These are key players. But the sad part about this, the people who really need to be here are not here. So, I'm going to finish up, I could talk forever, all you know that, I could do that. But the reality is a challenge. And our challenge to you is that you can't say, well, I never knew about it. Because when you leave here today, you will know about it. And there's no excuse. You don't tell your comadre, your vecino, you don't tell your church group, you don't tell the PTO, the chamber. There's no reason why you do not become a community advocate and go out and educate others. And if you say, but you know, I don't want to get involved, no me quiero meter, that's not an excuse. Children are dying. We have the average age of the data we've been collecting is 15 to 21 years. That's the range, 15 to 21 years old. We've had a few in the high 20s, but mainly 15 to 21-year-olds. That is terrible. And we have the capacity to take control of this in our community. So I thank you, and I thank Futuro, which I became a member today.
Excellent, thank you.
And I thank my friend Davis Rankin and Roxanne Garcia from KURV. Thank you very much.
Thank you, Chief and Eddie, for giving us that introduction. In our haste to get the program off, I skipped over something, and I apologize. One of my duties was to recognize a few other folks that we have in the audience, and I had skipped over that. So let me go back and take care of that real quick. In addition to our distinguished members of various school boards as well as our panelists, we also have As Eddie mentioned, we have Dr. Rene Gutierrez, the superintendent of Edinburgh ISD. We have Dr. Ricardo Lopez, the superintendent of Mission ISD. Dr. Mario Salinas, the assistant superintendent for operations for Mission ISD. We, of course, have Dr. Jay Gonzalez and members of his staff from McAllen ISD. We have Juan Ovalle from the Texas Department of Public Safety. We also have Mr. Sonny Palacios, who is a member of the Edinburgh School Board. We have any other either school board members or elected officials that I failed to recognize? I tried to get the list. Oh, sorry, Doctor, I didn't see you'd made it in. So we have Dr. Oliveira from the Sharyland School Board as well. Thank you. Okay, thank you. We also have with us, and I may, as the panel goes on, may recognize him a little bit later for comments, but we have a representative of the Texas Attorney General's office here with us tonight. So we thank the AG's office for being present, and they have some interesting approaches in dealing with this from the civil penalty side in terms of the distribution system. So as that may come up in the commentary, we may turn to you for some thoughts as well. So Mr. Joe Garcia from the AG's office, thank you for being here. Before we jump into the panel, Olmo, I'm going to ask you to click over to the next slide. We're trying to be a little bit techy this evening as Futuro McAllen. We're trying to move into the 21st century. As you all came in tonight, you were handed, I don't have one on this. You were handed little sheets like this. I hope you all got one. If you didn't, don't worry. But if you have questions for the panel, after the panel speaks, we're going to open this up to questions from the audience. So if you have a question, you can write it down on one of these little sheets. You can check the box of who you'd like the question directed to. Your name and email are optional. However, I will say this. We probably won't be able to get to everyone's questions. We've got Davis and his team over here of folks that are going to be sorting through those questions and helping me get the questions that need to be more urgently answered tonight. If you have a question that we don't get to, we will give those questions to the person, we'll compile those, give them to the person on the panel that you had directed the question to, and we will attempt to compile answers to all of your questions and either get them emailed back to you individually and or have them posted on the Futuro McAllen website. So we want to make sure that we have the opportunity, even if our time runs short, to answer everyone's questions as they come up. The techno part of this is we also have an app called Slido, or Slido, I'm not sure which. Slido.com/Futuro. You can go on your smartphone and enter the Slido app, and just to test it out, see if it's working. If you go into that app, it should ask you just to give us a quick vote. You can select what city you're from, and as you can see, we get instant updates of that. One of the features of this app is you can submit questions via the app. So if you don't want to do the old-fashioned Davis Rankin, write it on a sheet of paper way, you can do the newfangled Olmo Maldonado, input it in your smartphone way. So Olmo and Davis are both Futuro board members, so I get to pick on them for that. So slido.com/Futuro to input your questions. If you have the paper questions, we've got a few folks from the Family Services Department in McAllen ISD. If you all will wave to the crowd, if you're they're toward the back. If you have a question, kind of get one of their attention and wave the sheet at them, and they'll come pick it up and get it over to our screeners, and then the screeners will get it up to me here. So let's move on to our panel. We've got about 3 or 4 minutes apiece for each of our panelists to kind of give some additional information as they think may be pertinent to this topic. So we'll begin with Dr. Sandoval.
Thank you, David. And I would just like to say good afternoon, and thank you for inviting me. Like Mr. Olivares, I'm very humbled and honored to be part of this panel. And I'll start off with just a segment, since we do have 4 minutes. But what I wanted to say is Chief Rodriguez gave a very brief and excellent introduction here of the trajectory of the substances that have been abused by different generations over the years. And I just wanted to share that with synthetic marijuana, it's actually not something that's completely new. It's something that's been going on already since the 70s, but now it's finally becoming to such a magnified level. Marijuana itself has been something that's been abused for thousands and experimented with for thousands of years. Even since the 1980s, there's been companies out there, I don't know if you guys are familiar with, dronabinol and Kesamet. These are actual prescription medications that we use to treat nausea and vomiting and other types of conditions, for example, appetite in people who have cancer. And these are medications that are synthesized from the THC molecule or the marijuana molecule. The difference between these is that they've actually been studied and been put out by the FDA. Now, what ended up happening with these other medications, or these other drugs, was after those medications came out, different manufacturers starting to experiment to produce more. And just like at any university level, there was being research that was being conducted. And a professor from Clemson University, who's known as one of the godfathers of these, unfortunately, of these molecules, Professor Huffman, synthesized a whole lot of them before his retirement, actually. And once he retired, he put these out on a paper, and they got published. However, when these were created, they were not meant to be used on humans. Essentially, they were tested on rat models, and a lot of these were lethal doses type of medications. They were a lot stronger than the synthetic molecule. They were not the THC anymore. They had been changed to act completely different on the receptors. And so with that, we're left with these new synthetic drugs that we have no idea how they're affecting the body or what kind of effects they're causing in our patients. And so I work at John Austin Peña Memorial Clinic with Dr. Manisov, whom he's going to speak a little bit more about that. But we're in a challenging situation because at least 50% of our patients that we're seeing are experimenting with these drugs, and we're left in the middle without knowing exactly how to treat the withdrawal effects, or if they are coming in complaining of that they do want to quit, on how to help them do that. But with that, I'm going to pass it on to Dr. Manisov so he can talk a little bit more of John Austin Peña Clinic.
So this is a type of marijuana. It's synthetic marijuana, but this is nothing that I've ever seen before. I've been practicing for about 30 years, and when adults came to the emergency room, I usually could give them medicine to calm them down. I could give them something, sometimes just put them in a calm room. This doesn't work this way. The synthetic marijuana that is number one, it's not the original, because what happens is that all these manufacturers change the chemical a little bit, so you can't pick it up anymore. So you might pick up you develop a test to pick up on the urine, and then they change the molecule. Now we can't test it, so it's very, very difficult to pick up in the urine. So I can't tell what they're doing. I can't tell, unless they tell me or someone tells them. The only thing I have to go on is how they act. And so these kids are not, and adults, and we've gone down to 7 years old, kids smoking 7 years old. You can make it on the street mixing Clorox and rat poisoning and Raid together. That's not the formula. But they're smoking it, and it gets into the brain. It binds very tightly, and actually these physical holes, and some of these things are permanent. So the kids come in, and they are permanently damaged. So it's a lot worse than I've ever seen. I've been able to give an antipsychotic to a patient that helps them get through the next night. I can't do anything, so it's very difficult. We originally partnered with Hidalgo County and Mr. Eddie Olivares, and they gave us a clinic, the John Austin Peña Clinic. And we developed a team in collaboration with a lot of organizations throughout the county, and especially with the university and the School of Medicine. And we developed an integrated, interprofessional team who takes care of these kids. So we right now have about 220, we'll get up to about 400 of these kids. And the kids are really good kids. And the social workers and the nurse practitioner, Miss Linda Nelson, is the Senior Director of Operations, and Araceli Ramirez, who's in the back right here. runs the program. It's amazing how much work they do with these kids, and the kids are great kids, and they're getting help, and we are doing this interprofessionally. The one big thing I want to emphasize is that we're doing great work and we're showing good results, but we can't do this alone. It's very imperative that we work together. We talk to the school systems. We talk to law enforcement. We have these forums, and we integrate what we do together. I don't want to come in and change what everybody's doing. What I want to do is come in and augment what's already been done. And this is a big problem, much bigger than, what I see right now is just the tip of the iceberg. And it's going to be, in my opinion, is going to be worse than opioids across the nation. And we have a chance to make a difference here, and we have a chance to working together to do this. But we at the John Austin Pena are pairing with a lot of different organizations. Some of the things that you want to see, that you might see, your child will be drooling if they're acutely intoxicated. First of all, usually kids who smoke marijuana are giggling and hungry and don't want to do anything. Kids on synthetics can be psychotic. They're hearing things. They think people are chasing them. A lot of them undress and they're running around in the streets. They're harming themselves. When they come in to see me, I can tell without even asking them. They're really anxious, moving around, drooling, sweating, pale. Their heart beats really fast. Their temperature can get very high, 102, 103, 105, and it doesn't respond to Tylenol. It's a different kind of heat. So you might see in your kids, if you're acutely intoxicated, you see that. If in your kids, people ask me, well, how do you know your kids are, smoking or doing drugs? And what will happen is that they might have been really good in sports, they might have been really good in school, and they might have been doing very well. And all of a sudden, they're changing who they're hanging out with. They're hiding things. They're being secretive, and then you might see some of these other behavioral changes. I've gone over 51 seconds, but my recommendation is, thanks. My recommendation is parents need to be very, very involved. You need to talk to your kids. You need to know what they're doing. You need to, you don't have to harass them, but you need to talk to them and know what they're doing. Get involved in their life. Ask them about it. I get my information. I get it from my kids. They tell me what they're smoking, what they're doing, and they say, "Oh yeah, we do that all the time." Well, we don't do it, hopefully. It happens all the time in the schools. So getting to know your kids, talking to them, I think is probably the biggest thing. I appreciate you having us.
Well, good evening. I'm Dr. Irizarry. I'm a psychiatrist. I work for Tropical Texas Behavioral Health, and I work for South Texas Behavioral Health. Thank you for having me. It's an honor to be with you guys here, talking about such an important subject for our community. This decade has been coined the decade of the brain. Advances in medicine and in the field of neuroscience are showing us things that we never even started to dream of about what the brain is able to do. Your brain is everything. Your brain is who you are and what you do. We have learned that the brain and its complex connections continue to grow over a young adult's life all the way up to 25 years of age. We mentioned earlier that the majority of the group that is being affected by this is a group between the ages of 15 all the way to 21 and even older than that. So right when your brain is in its most important moments of development, we are exposing, or these kids are getting exposed to this type of situations. The brains are what makes us who we are. The brains that will make who we will and what we'll do as a community are the highest risk that I have seen ever in my life as a psychiatrist, which I've been now for 10 years. The same knowledge of the brain that is allowing us to understand the intricacies of how behavior is interconnected is now being used to specifically target weaknesses in people. We are now in an era of designer drugs. Drugs that are designed for specific reasons, just like the synthetic drugs. Here in our community in the Rio Grande Valley, we are facing a threat to our young brains that are still in development. Under the false identity of being called marijuana, by creating synthetic marijuana, and other designer drugs, our young brains are exposed to some of the worst toxins that we've seen so far. This is not marijuana. This is not spice, K2, Yucatan fire. This is not some herb in a nice little packet. This so-called synthetic marijuana is really a poison to the brain. A brain poison capable of changing somebody's behavior, and at times it does it permanently. A brain poison capable of inducing one of the most difficult conditions we have in psychiatry called schizophrenia. I've seen already cases, patients that have transitioned into schizophrenia after being exposed to these substances. A brain poison that may take you into a trip with no return. We are here today to tell you that this is not marijuana. This is a synthetic cannabinoid. It's a totally different agent, a chemical compound designed to produce a permanent change in receptors in your brain. Permanently losing touch with reality, acting not like yourself, seizures, coma, and death are complications that we are already seeing here in the Rio Grande Valley. We are here to tell you, don't take your brain for granted. Your brain is everything. Your brain is who you are and what you do. Don't risk losing yourself and losing everything in that process. Like the UTRGV slang says, let's really inspire the world and let's say no to synthetic cannabinoids. Thank you.
Good evening, everyone. My name is Mariano Resendez Jr., and I'm a licensed chemical dependency counselor intern from Palmer Drug Abuse Program right here in McAllen, Texas. I'd like to start off just thanking Futuro McAllen for, like I said, putting this event together and for the opportunity to come out here and speak to some of the administrators and board members that are in the crowd, as well as to a lot of the families right now and family members that are in the crowd right now. It's an awesome thing that we have this turnout that we have. This really shows that there is awareness that is needed. This really shows that there is a caring in this community. Along with that, it's a really funny story how I became a part of Palmer Drug Abuse Program. I remember being at least 12 or 13 years old when my mother originally took me to Palmer Drug Abuse Program because she found a pipe in my room that I had made, and I'll tell you, out of a Pringles bottle. And she took me there, and my mother took me there because just like most parents, like most families, she didn't know what to do. But she knew that there were resources in the community that weren't necessarily services that were where you had to worry about insurance or you had to worry about paying. And she received the referral to Palmer Drug Abuse Program, for instance, from a friend of hers, and had heard that some of her friends had taken their kids there and heard that it was successful because it ran off of a 12-step program, similar to Alcoholics Anonymous or Narcotics Anonymous as well. So my mother took me there. And I remember speaking to the counselor at the time, and the counselor went over kind of a questionnaire. And it's similar to the questionnaire that we use today, with little differences. And the one that we use today has been tweaked quite a bit to really engage the client and really find out the root of the problem that the client that comes in is dealing with. But I remember the counselor asking me some very vague questions about why I like to smoke marijuana, why I was using drugs, what I got from it. And my answers were very, very simple. And it was because I liked it. And it was because it was a release from everything else, from whatever stresses I was feeling in my life. It was an escape from anything and everything that I didn't want to feel. And I remember going through that and really opening up because I felt like I was in a place, I was around somebody who was gonna allow me that. It was a third party that had no interest in the matter but was willing to listen and was willing to help me with my problem. I can't say that I continued services with Palmer Drug Abuse Program. I'm sad to say that I didn't. I know that my mother spoke to the counselor, and what was spoken in that room, I guess, was confidential because it was never released to me what was spoken there, what was spoken about. And I remember that my mother didn't really follow through, and me being 12 and 13 years old, if my mother wasn't gonna push the issue, then neither was I. One of the biggest questions that I get from parents, from administrators, seeing is that I also work with the PSJA school district in their DAEP, which is their disciplinary alternative education program, and doing individual counseling with the children there. We work with children who are from 12 to 17 within the school system that are suffering from substance abuse and that end up at their alternative education program because of substance abuse. And like I said, one of the biggest questions that I get asked is, how do we prevent our kids from using? How do we stop it? How do we get away from it? How do we know? What I do is I use the Brady Bunch reference, if anybody gets that. And really what it is, it's really taking things back to a simpler time where we communicated with one another, where we sat down and we spoke with our children, where our children felt comfortable sitting down and speaking with their parents, and where our parents took the time. Not saying that this doesn't happen pretty often now, but it seems like many children that I speak to and that I come across kind of fall through the cracks of communication, and they're allowed to be asked, "How was your day?" And the question "good" is simply accepted, and there's no digging. A couple of the panelists before me mentioned this, and they said it's not to interrogate your children, but it's to become a part of their lives and to be in their lives. That's going to be as simple as it gets. The one thing that I really stress is communication. Communication. Without communication in any relationship in your life, there really is no relationship. It fails to be one. Moreover than that, one of the pinnacles in prevention is going to be education, education, education. It's going to be a matter of the families, of the parents, of the faculty, of the administrators, of the board members that we have here today, is everybody, all of us getting together and really educating ourselves about the subject matter. Not just synthetic cannabinoid, but drugs just in general. Right now, one of the number one abused drugs nationwide is prescription medications. And that has to do with the fact that they're so easily able to be gotten to. They're able to be accessed within the home. Synthetic cannabinoid is something that is not new, but it's something that's being exploited by our youth because it's hard to detect. It's very easy to use, and I don't have one on me right now, but one of the things that it gets used in is a pen cap. So something as simple as that you would find around your home, something in an office supply store, something you would find in an office, something you would find at school, that seems very, very innocent. It's a writing tool, but it can be used to smoke synthetic cannabinoid and other drugs. Going away from that, I know we're limited on time, but I guess the intervention part of this is really getting into sitting down with our kids, sitting down with our family members, and really becoming and being a family. And I like to really stress that as one of the pillars. It really has to be one, of course, is going to be family values, education, and it's really going to be just becoming overall the best that we can be, not just as a family, but as a community. As people who are going to come together and really push this issue as something that, like I said, that needs to be addressed, something that needs to be cut down on, something that needs to be enforced, something that needs to be cut out. Our resources that we have in this community, they're all over the place. And that's saying it very simply, but you can go to your local church, and I'm going to tell you about 80% of the time, the church that you attend, or even if you don't attend church, Many of the churches in your area do have either an Alcoholics Anonymous or a Narcotics Anonymous ministry. There's services, of course, like Palmer Drug Abuse Program, where I come from, where we offer our services for free, where family counseling is offered, where adult support groups are offered, where family support groups are offered, where support groups for our youth from the ages from 12 to 17 are offered. And they're also given a place to come and have fun in sobriety and find out that you can hang out with kids your age, you can hang out with people your age and not have to be high. You don't have to be under the influence. Lastly, I'm going to say maybe one of the recommendations that I would make is simply going to be maybe proposing legislation that would kind of turn things around and make it so where we can really hold ourselves responsible for our actions, especially our youth. Thank you.
Good evening. My name is Adrian Garza, and I work for McAllen Independent School District. And what we have is a program in place called Family Treatment Program. And first of all, I want to thank Futuro McAllen, the panel, for being here with us. But I think it's true. In the initial meetings we had with these various agencies that deal with licensed chemical dependency as well as mental health, there's two discussions we had. One of them was, first of all, as a school district, I wanted to make sure they understood that we aren't the experts in the field. Knowing that there's experts out there, reaching out to them, making sure that we're gaining knowledge and we're getting perspective on how to deal with synthetic drug use or other drug use. And in doing that, I wanted to make sure that from the very beginning that our team here at McAllen ISD understood the terminology that a licensed chemical dependency counselor would use, not necessarily a psychiatrist, but understand where they're coming from, as well as the medical aspect, which is a medical doctor, as well as law enforcement. I think that right now is learning that language of what to use, how to use it to ensure that families, children, and staff members in school districts are understanding this is a legit problem. I don't want to speak for all school districts and generalize and say, okay, this is an issue in all school districts, but I am. I'm just going to say that it's out there. There is a synthetic use issue. The best thing to do is to confront it like this, making sure that community members have access to resources like we have in the cafeteria. All of you have the option of going over there and seeing what resources are available in the community. If you have family members that are out there, if you have students that you know of, friends of friends that have children that may be using drugs, or synthetic drugs as well, that there's help out there. Ensuring that as a community, we're able to tackle this problem, this issue, and provide the resources necessary to ensure that every child has that fighting chance to overcome. The other issues we discussed was dichotomizing drug use and mental health. They're intertwined, and they're obviously a child that's dealing with a diagnosis in school, a child that's dealing with a diagnosis early on in elementary as they move on to middle school. We've seen it. And what happens is they start utilizing drugs more often to self-medicate. And I want to make sure that the community knows and taking that stigma away that mental health is one thing and drug use is another thing. I believe strongly that they're strongly intertwined, and that if you treat one, you end up helping the other. In other words, a cure, a child, student, adult overcoming, making sure that they're treated holistically, physically with your medical doctors, mentally with psychiatrists, mental health professionals in your community, as well as your LCDC counselors who are all over the place. They're out there, and I can't stress it enough. You have to reach out. If you can, please go to the cafeteria and get the resources that you need. All the programs that we have in place here at McAllen ISD is something that I believe every school district needs to have in place. You need partnerships, you need memorandums of understandings, memorandums of agreements, interlocal agreements to allow access for counselors, licensed chemical dependency counselors, social workers onto your campuses. If we're not doing that, if we're not allowing the community to assist us in our issues, then what we're doing is we're closing the doors on our students, on our families, and as they move up the ranks of grade levels, as they go from second to third grade into middle school and high school, we're dealing with these issues over and over again. If we don't cut it down in elementary, then we're going to see it in high school, and that's a preventative approach. So if you can, after this, I would just want to mention that Tropical Texas Behavioral Health at Renaissance, South Texas Behavioral Health, Behavioral Health Solutions of South Texas, Sendero Group, New Beginnings, Raising Hope, Buckner Family Services, Palmer Drug Abuse Program, Mesquite Treatment Center, Hidalgo County Health and Human Services, UTRGV School of Medicine, Austin Pena Clinic, our McAllen Police Department, Edinburgh Consolidated Independent School District. We also have some members from Sherryland as well as Mission, McAllen ISD Police Department with Chief Esquivel, and of course our McAllen ISD Parental Involvement led by Lorena Ansaldua, Hidalgo County Sheriff's Department, as well as our program. They're all out there. They want to answer your questions. I know we'll field some questions right now, but I just want to make sure that a lot of people out there, it's being videotaped. A lot of people don't have the sheet that you have in place right now, and that's why I want to make sure that they understand that there's programs out there, and any one of these programs are willing to assist you. Appreciate that.
Thank you. Thank you, Adrian. That's a great wrap-up. I'm going to real quickly ask Joe if you'll either step up and we can hand him a mic. Adrian, could you maybe hand Joe Garcia a mic? Joe is with the AG's office. And Joe, just make a couple of comments about the things you mentioned to me in your email message. And then if you'll hang on to your mic, the first question I want to go to, and if y'all can all see the questions scrolling up here, so please do put your questions in either on Slido or get them in on the sheets and they'll get them up to me. But the first question I'm going to go to, actually, I may want you to help answer. So don't go anywhere after you say a few words.
My name is Joe Garcia. I'm with the Office of the Attorney General, Consumer Protection Division. I'm the managing attorney there, and our office manager, Lisa Luna, is here also. The way we help out is we like to partner with criminal enforcement agencies, law enforcement agencies, because they go in and maybe they raid someplace or they arrest people, but the evidence that they are able to get helps us in proving on the civil side. We have civil enforcement powers, and so we go in, file a lawsuit, because if I'm not mistaken, I think law enforcement agencies can arrest the people that are selling, is that correct? But not so much the owners of the businesses?
We can't even arrest them as well if the transaction is clearly made for consumption.
Right, okay. But for the most part, I've seen is usually it's just the people selling, and so what we do is we sue the owners of the business, we sue the business itself in an effort to try to prevent them from doing it again. We do that through obtaining a permanent injunction, which will prevent them from selling the substance again. If they do, then we can put them in jail. But the part where it really hurts them, because as you know, a lot of times it hurts in the pocketbook the most, we work under the Deceptive Trade Practices Act, as well as the packaging and labeling laws, and we're allowed to request $20,000 per violation of those laws. Each package or each sale is $20,000. So if you get 100 packages, you can, $2 million judgment, and we abstract the judgment, which means we file it for record at the courthouse, and people can see, anybody can see that. That's where it starts affecting them. And so that's how we help, because a lot of times the injunctions, the threat of going to jail on our side of the fence, that if they violate and sell again, is how we can help. Usually, we kind of go hand in hand with the police department. Sometimes, right now, we're working with the Corpus Christi Police Department, and we're going to arrest and file a lawsuit at the same time. And the purpose is because at the Attorney General's office, we want to make sure that people know that not only the city and the county, but the state is also concerned about this, and we are ready to close down the business if we have to, and stop this from going on. So thank you very much.
All right. The first question I'm going to move into, Joe, maybe just stay handy here in case you want to add something to this. There's been a number of questions that I'm going to kind of summarize into one general topic, and I'll address this to Chief Victor and to Sheriff Guerra and to Joe. This question centers around these shops and these locations where this product is being sold. I'm going to kind of phrase it the way someone phrased it to me earlier. We know where all these shops are. Can't we just round all these guys up and have them come in and sit down in your office and have a talk with them about whether they really want to do this or not? So what, between law enforcement and the AG's office, is there something more aggressive that could be done directly at the source, at the retail source of these materials? And or maybe Representative Munoz, is there something we need to do legislatively to give you all more tools to do that?
Well, the problem that we have, we've got some challenges because we don't want to violate anybody's civil rights. Again, it's not illegal, just like the chief said. It's not illegal to possess this product. It's as long as they're not selling it for human consumption. So we have to be very, very careful when we do our investigations into these people that are selling it. So we have some challenges, and we work around those challenges to make some of these cases. But we have to be we don't want to violate somebody's civil rights and accuse them of doing something illegal when actually I have no case to make unless we can prove that they're selling it for human consumption.
Chief, anything to add to that?
Yeah, I just want to add to that, and that is, we're
A little closer to the mic.
in the eyes of the Constitution, we're government, and therefore all our actions are highly regulated. Any approach of any person has to be on a probable cause basis, and oftentimes we're tasked with why can't we do this? Why can't we do this? We just can't do this. We've got to have a lawful basis for which we're going to stop either a person or seize a person, which is a stop, or seize his property. So the question was, can we do something about it? And I'll tell you this, we've got 8 to 12 different shops in McAllen. We know where they're at. And it is as if, we let's say we run them out. And then so what the next item of abuse is going to be milk, let's say. So now we run milk out, and it just goes on and goes on and goes on. It can be never ending. I feel that the most value that can come out of this today is learning what this is and learning what it's causing in our kids, first and foremost. It is kids that are putting poison in their brains. And we as a community need to know this. Parents, we need to educate our parents and let them say, when you see this is poison. And then the next thing we need to do is, spend time with our kids and show them that they're effectively cracking open their heads and putting poison in their brains. And we can go down the punitive route. The punitive route, the only problem with the punitive route is that it's only bad when you get caught. Otherwise, it's a challenge, and it's always going to be there. So I'd rather spend time educating our kids in what they're doing to them and showing them and demonstrating what they're doing to themselves, and hoping that way we save more kids as opposed to try to incarcerate one or two and maybe close a shop down. So that's what I would, and all of the things that I'm going to close up with today is, education, and we happen to be in an educational institution today. It's education. And it's our parents, our kids, ourselves, and let's together save our kids.
If you would just submit them through the moderator. If you would, Carrie, please submit them to the moderator and they'll, or to the panel, and they'll get them up to us. Thank you. Representative Munoz, let me follow up on that. There's been several questions that have been listed here in terms of what the legislature can do, what is being done by the legislature, especially since the composition of these drugs is a moving target. And then another way the question was phrased, is there a way to construct some sort of umbrella law to cover all of these products so that it's not a moving target in some fashion?
Yeah, definitely. And I can speak to the most recent legislative session that addressed this issue in several forms. And first, there was a bill that was passed that allowed the Commissioner of State Health Services to designate as a consumer commodity as an abusable synthetic substance if the Commissioner determines that that commodity is being used not only to manufacture this synthetic substance, but it's also posing a threat to the public health. There was also legislation that, as we mentioned earlier, was dealing with outlawing and penalizing the different compounds and compositions that are used to make up these substances, and one specifically dealing with the labeling, the false, misleading, or packaging of these types of substances. So I think from the standpoint on the legislative side, we're moving more not only towards the criminal side, but as Mr. Garcia mentioned, which were the civil penalties as well that would be available from the Attorney General. I think what we're going to see going forward is definitely outlawing just the possession of these substances, which is, I think, something that we're going to be addressing with not only our local law enforcement officials, but some of our community leaders within the different school districts. But we're definitely here not only as a resource, but to offer our assistance and help as we prepare for the next legislative session to see how we can continue to address this and find the solutions to these challenges.
Okay. You mentioned that one of the new laws allows the State Health Services Commission to essentially designate without further legislative action. Is there a mechanism, as these folks here on the front lines are encountering new products, new substances, can you quickly explain kind of what the mechanism is for reporting that to the State Health Commissioner so that action can happen quicker? It's certainly great that it doesn't have to wait till the next legislative session, but how does that information flow?
And I think that was definitely one of the reasons why they wanted to give the tools to this individual to make sure that they had it at their disposal to address this. And this bill just became effective September 1st, 2015, which was just recently, a couple of months ago. And one of the main ways we can do so is to forward that information or the composition or the substance itself directly to the commissioner, to his office, which can be done either by that individual, by the school district, by the law enforcement side, or even with the help of our specific office in trying to make sure that they have that information in front of them so they can act as quickly as possible.
Okay. This I'm going to address kind of to all of you. I don't think there's anyone really specifically. We've talked quite a bit about the product being sold through the smoke shops and through those mechanisms, but I understand that there's also kind of the traditional drug market, if you will, the kids in school or the folks hanging around the parks that are selling the product as well in coffee houses, et cetera. Is that product flowing from the smoke shops, or is that product coming through a different chain? And then kind of tying back to that, you've mentioned that some of these products are laced with, Clorox, Raid, things like that. Is the stuff coming through the smoke shops laced with that, or is that coming through a different, help us understand, are these multiple channels? Are they the same channel? How does this work?
Well, I invite everybody to go into the cafeteria. We've got a static display where we're showcasing the actual product and where you
Excellent.
can see it.
Thank you.
And what you'll see there is if there's a big like a tinfoil bag. I think it's a 1 pound bag where these dealers will buy it over the internet online, have it delivered, and then they get the creative packaging material, and they'll put it separate it out on 2 grams or 4 grams, and then they'll seal it, and that's what they buy that 1 pound package off the internet for $40, and and then they sell it for 2 grams. They can sell it for 2 grams for $10, the 4-gram package for $20. So they're for a $40 product cost, they can make anywhere up to a $2,000 profit off that one pound sale, and that's where we see most of our arrest. In 2015, my narcotics investigators, we made over 100 arrests, and to date we're a little over 44 arrests for manufacturing, possession, and delivering this synthetic drug.
This is a catalog that came off of one of those smoke shops. If you notice, one of the things up right off the front, and one other thing that, I mean, this stuff is sold as incense. It's sold as aroma salts, aromatherapy. It's sold as various different things. But one of the things you'll see here right quick, and this is how they cover some of their ground right quick, it's not for human consumption. But to answer the question about what it looks like, these are how you can get them. And we'll put this out there for you all to take a look at. These are various forms, cellophane packages, all flavors, all kinds of different things. The other thing you'll notice at each one of these pages, you'll see the price up there. Like, for example, $35 for that product, $25 for that one, $30 for that one, and so on. And you know what they're sold as, aromatherapy, not for human consumption. So this is how they get into our kids. This is where they're buying them. It's what they're doing with them on the premise that it's synthetic marijuana, so marijuana is illegal, therefore let's go get what is legal, and it isn't marijuana, and what they're getting their high and their poison from is from what those herbs and plants are being sprayed with. So that's basically an end around the marijuana problem, if you will.
The scariest part of that is how a lot of this stuff is marketed as well to the youth. It's given names. It's they put different flavors and aromas and stuff like that in there to make it appealing to the youth or to the population that's actually using this substance. It's funny that you mentioned a coffee shop, because what they're having, one of the biggest epidemics within this topic is a strain called house blend. And what that, I use strain very loosely, but house blend is literally that. It's literally something that somebody cooked up in their home, took some smokable herbs. From my experience through a lot of the clients that I see, I've even heard of people making this in their home with lawn clippings and then grinding it up so fine so that it looks like a marijuana, and pretty much going under the kitchen sink and putting it in a spray bottle, in a Windex bottle, and spraying and mixing it together and just spraying it. Then further going and using what they call, I guess it's a dehydrator, so that way it dries, and then it looks almost just like marijuana. And like I said, nobody knows what they decided to blend, what they decided to spray on these smokable herbs or even lawn clippings, and just sell and just say, here you go, this is going to get you high. I've heard all sorts of horror stories, and I've seen it. Some of what's out there right now. There's a brand, like I said, called Scooby Snacks. There's a brand out there called Cheesecake, and that sounds like a dessert. And like I said, that's how a lot of these are marketed, in order to tempt, in order to get, in order to grab your attention. And it's not just your attention, it's the attention of our youth. Cheesecake is something that's really popular, and the reason, and one of the really horrible things behind that is that it's laced with heroin. So a lot of the youth and a lot of the people that are stopping to use that product, when they stop using, they're almost going through some of the same withdrawal symptoms that a heroin addict would go through whenever when they're withdrawing from that.
One last thing I want to say on all of this. You know, these products that we're talking about here, I'm not addressing the heroin topic he brought up right now, but these other products we're talking about here, the spice and it, they don't test positive for marijuana. So if you're doing drug testing for, let's say, this kid's, because it's not marijuana. And that's again, that's one of those false readings that we say, well, he's not positive, so it must not be, so then it's okay. Because you're not going to get a marijuana positive test for if you're doing some of that testing. So just wanted to mention that as we go on.
I think what's important is the fact that everyone here today, this is not synthetic marijuana. This is not marijuana. The medium in which it's being used, this herbal substance, this natural substance, that's just the medium for it to pass. This could be used, like you said, in tea. It could be used in a liquid form. It could be used in a vapor cigarette. Get away from marijuana. Stop using that. This is a synthetic drug. Or even better, it's poison. It gets poison. Simple. It gets imported into the United States legally from China in huge, multi-100-pound containers as insecticide, as for non-human consumption, product development, industrial cleaning supplies. That's how it gets from China to the U.S. Now, here at the Valley, we can't deal with that. We don't see it at that level. But the reality is this is a very well-organized industry, a very well-thought-out industry. And the reality is, Chief Rodriguez said the right thing. How are we going to stop it? The more educated the parents are, the more parental involvement there is, the more awareness that we stop hiding behind the veil that this is all natural and all good and it's wonderful. The sooner we take command of our own children in our community, the quicker this is going to get under control.
Can I add something to that?
Sure.
I think we're forgetting, yes, education is important, but we're dealing with a generation that is constantly glued to their phone. And so this is being delivered to the house just like pizza. I would share the website here, but I'll probably get arrested by the sheriff here. But just before this, I was on that website where you can go to your state, and it will tell you which chemicals have been outlawed by Congress or your legislature. So you will order substances that are not illegal in your state. And so now you're dealing with that as well. So these kids know that, and the website itself will tell you that. And they get delivered just like any other package to the house. So not only are you fighting the shop down the street, but you're also fighting the internet as well. So
let me move on to something here for our medical panel. There's several questions that have come in along the lines, and it's some things that you all touched on, but maybe if you could elaborate on a little bit more regarding both the addictive nature of these products and the damage they cause when compared to, to folks of our generation who understand a joint. So give us kind of a little bit more detail, if you would, on how addictive these new products are and the type of effects they have versus the conventional drugs that we're more familiar with.
So these drugs are very addictive, and the reason they are addictive is because they were synthesized to be addictive. They're synthesized to bind into your brain. So everything we have, the way our nerves communicate with each other are by receptors. They're like little things that turn on and off. And so these chemicals and all the medicines that we take bind to different receptors. And some of them do good things, some do bad things, some have bad side effects. These are specifically made to be addictive. And the other thing is that they bind to types of chemicals in your brain that feel good. And so, for example, dopamine in your brain feels good. And it makes you want, it's a reward chemical, so it makes you want to do things. And so the high that they get, it feels good. And so it becomes addictive by chemical because of receptors, but it's also addictive because of social reasons. Same thing as tobacco can be addicting by nicotine, by receptors, but it's also socially addictive. So these are made to be addictive. The problem is that, even if you looked at the marijuana that in my age, there's nothing compared to the marijuana that's now. It's a lot stronger. It binds a lot. They actually breed it to be stronger, and so it affects the brain. So we do have THC, or we do have cannabinoid receptors in our brain. And so there are these receptors in our brain that regulate our behaviors, what we do, why we eat too much, why we exercise, why we feel good when we exercise. All the things are mediated by these, and so we develop chemicals to reproduce those. And I think the chief said it really well, is that we're going to have to outlaw everything, because eventually you can use a lot of different medications and a lot of different chemicals to make yourself feel good. Why is it that our kids have to do this? Why are they doing this? Why are adults doing it? But specifically, why are our kids turning to these things and turning to, I think that's where we have to, so the education has to be focused on why.
I think that regarding withdrawal symptoms from synthetic cannabinoids, my first hand experience is with adolescents in the psychiatric unit that have developed psychotic symptoms, and after I get them admitted into the hospital, then they develop the withdrawal symptoms. Can I describe withdrawal symptoms so you have an idea? It's going to be very hard, because it is not like heroin withdrawals, it is not like Xanax withdrawals, it is not like cocaine withdrawal. We're still trying to learn how this withdrawal really occurs. What we know so far is that usually it takes about 5 to 7 days to complete a detox on withdrawals from these substances. When you compare that from acute withdrawal from heroin or from Xanax, which may last 72 hours, that is a prolonged period of time. You're withdrawing from the substances. And the reason why it's so complicated, like Dr. Manozov was alluding to, is that because these herbs have multiple chemicals on it. And so as physicians and clinicians, we can't really identify the particular agent so we can directly target. We have to use an umbrella approach and try to do everything that we can to treat those withdrawal symptoms within that process. But like I mentioned earlier, what's most scary about this is that we're seeing permanent behavioral changes. So, I mean, I'm not that concerned about the withdrawals. I can take care of those and help those kids get over the withdrawals and move on. The problem is by the time they're done, sometimes their IQs are suffering in the process. Their ability to collect memories, their ability to process, think rationally is affected. So these chemicals are actually changing this kid's behaviors at times permanently. And so that's the most concerning part, more than withdrawals.
Thank you. Let's go. We've got a few questions that have come in. A few questions come in regarding treatment and where to go to get help. I know we have PDAP here and we have the John Austin Pena Clinic folks here. So if y'all could address those questions, let me read a couple of them here. One of them says, "What's the process for receiving services through the John Austin Pena Clinic?" Another says. Lost it. It was right here. Basically, if I feel one of my children or a family member is using drugs, where do I go to get help? How can I get help for them, whether they're an adult child or a not adult age? So if y'all could address those issues.
I'd like to address that if I can. It's really gonna start off with the severity of, I guess, the addictive behavior, and where you're really gonna find that out is really gonna get them. I'm gonna say assessed within like a treatment facility. Within any treatment facility, they will use what clinicians use, which is right now the DSM-5, which is the manual that's used to diagnose, which is the manual that's used to diagnose behavioral health issues and also onset, like I said, onset behavioral health issues and whatnot. Within that, at that facility, normally whether it's an adult, whether it's a child, they're able to be assessed in the sense of the severity of their addictive behavior, or as well as their diagnosis. Within that, it's able to be assessed the level of care that they need. And within that, at that time, it's the clinician that's going to determine whether or not they're going to need inpatient treatment, whether they're going to need outpatient treatment, and also the duration, and the time within that program. Moreover than that, there are also, like I mentioned earlier, within your local community, there's churches that do offer 12-step programs. You do have facilities like Palmer Drug Abuse Program that offers a 12-step program. You have facilities like New Beginnings Behavioral Health, like Mesquite Treatment Facility in Harlingen. They also have, I believe, it's the Austin Pena Center. You also have, I know that there's I believe a military academy that has come up in Weslaco, which helps youth between the ages of 16 to 18 with credit recovery, and also helps them with job skills, so that way whenever they get out, they're able to attain work. And it also helps them out within the community as well. All these resources, just on the whole, really just help together and collaborate together in order to get the person, like I said, whether it's an adult or a child, the best possible help that they can receive, the best services that they can receive.
Okay. Yes.
If you have a child or an adult who's acutely intoxicated and it's dangerous, emergency room, you need to go to the emergency room. This is emergency, so a lot of people ask me, well, you go to the emergency room. If you have someone who you're concerned about, there's a lot of different places you can go that we can evaluate them. I think it's important, and I think Adrian mentioned it earlier, is that having an interprofessional, integrated approach. Having one person doing it is not, you need to have nutritionists, you need to have social worker, everybody working together. The Pena Clinic that we work at, which is actually was funded by the Methodist Health Ministry as a grant, was brought together so as a bunch of different people working together. So I think it's, one, if it's an emergency, you go to the emergency room. Two, you can talk to your physicians, and then you can also go to all the multiple, and we've listed some of them, to take them for evaluation depending on what's close to you, your cost and your insurance, et cetera. But I do think, it isn't a medical emergency. If they're acutely intoxicated, you need to take them to the emergency room.
I like to add, I know I've been involved in the substance abuse treatment field for a very, very long time. Many of you here were my students at one time. I know, there's like 2 or 3 in here. The reality is there was a myth in my generation, in the majority of people's generation, substance abuse, mental health, separate. Medical illness separate. The reality today is, and I want to make this extremely clear, what Dr. Manusoff said was so true. The level and the toxicity of the current drugs that are being used are at the severe level that medical intervention must be considered immediately for assessment, stabilization. It is critical to your child or your loved one's life. I cannot stress that enough. This is no longer about what came first, the drugs or the psychological problem or the addiction. It doesn't matter anymore, because now you have severe medical complications. Do not assume that you could do this with counseling by itself. Must seek an assessment by a medical physician.
Right.
You must.
Thank you.
David, if I might add really
Sure,
quick.
quickly. Yeah.
As far as a school district perspective, I think that we make it hard on families to be able to reach out to community organizations. And I think the question was about a referral process. How do we get a student from point A to point B for services? What we did at McAllen ISD is we integrated the referral process for all these organizations. So we streamlined their referrals and we put them into one, so that a family member doesn't have to go to Edinburgh, to McAllen, to Mission to find out if they can actually get help. What we do is we do the legwork for them. As school districts, it's imperative that we look at how we make it easier for the families and harder on us. I think if we're letting students search for these organizations on their own in our communities, we're doing them an injustice. We got to assist them as much as possible. We know strategies, we're taught systems, and in order to maximize potential for that student to get treatment and recover, then we have to help them out in a system as much as possible. And if that is sitting down in front of a computer and getting together with meetings with community organizations, sitting down with them and ironing out a system for your school districts, that's key, because you want to make it as easy as possible for that child and that family to get access to mental health services as well as substance use disorder services. Yeah.
Thank you. Well, we're coming to the end of the time we had allotted for the panel. There's one question that's popped up 2 or 3 times here, and I think that it's a good one to end on. And that is, if you had the ability to impact the problem immediately, what one thing would you do? I'll leave that to any of you all that want to jump out. Sheriff, you look like you're itching to answer that, so we'll start with you.
I think it's been repeated here so many times, and basically, parents need to be parents, period. They just need to start being parents. And I want to commend the parents that are here today in the audience for getting, again, educated on this problem. But that's where we need to start. Parents need to be parents to their kids.
And the kids and all the people here who are involved, I see a bunch of people who are involved in having the adults talking to the kids, your coaches, the people who you work around, your community, all talking together. So as parents, you're absolutely right, I agree. As parents, we have to talk to our kids. But all of us, it takes more than one it takes a community. We have to take care of our kids together. We have to work together to solve this problem.
One of the other things, and having worked with all these people here, pretty much every single one of them, we work together on a daily basis. I gave a challenge to each and every one of you. There's no one should leave here today without saying that I don't know about it or ignore it. But more importantly, if you are a leader in the community, if you're an elected official, if you hold a high-level position of authority and decision-making, what are called FDMs, final decision makers, you have a personal responsibility to help all of us fix this problem in our community, be it synthetic drugs or poisoning, be it abuse of children, be it any particular topic that's a social issue in our community. You cannot just say, well, you know, we have a state representative here, it's his fault, his responsibility, or we have the sheriff, or we have the chief. No. Ours, all of ours. And you leave here today challenging all your neighbors and everyone. We must do something about it in our community.
You know, the one thing I would say is, you know, let the learning begin. Let the education start. Many years ago, we used to tell people, kids in the course of trying to prevent drug abuses, you know, you're putting poison in your system. Today, with this stuff, it is true.
It's true.
It is poison. These things are being sprayed with poisons. Rat poison has been mentioned as one of them, and many other things along the way. They're actually putting poisons into their brains and their kidneys. And we still don't know the long-term effect of this stuff. So I think the one thing that we can do, above all these things, so there's plenty of material here that we can all take and learn from it. There was a symposium a month or so back in Weslaco where much of this information is online already as well. And I would refer you to prc11.org as a website to get that symposium material. It's all there. You know, what this stuff is, how it looks, the effects, the science behind it, some of the legislative history behind all of this stuff. And PRC, by the way, is a Texas Department of State Health Services Prevention Resource Center. And they have 11 centers around the state. 11 happens to be number one. I mean, number 11 is the one down here for us, our region. And so this stuff is at their website. Let the learning begin. Let's understand when we see something in our kids. You know, let's us learn, and then let's tell our kids and show our kids by, you know, not by just saying we don't want you to do it, we don't want you because it's bad for you, it's bad for you. Let's show them. Let's show them the science. You're putting poison into your brains. and let's start saving kids that way. That, I think, is the most efficient way of doing it. So God, thank you all for being here, and God bless. Thank you.
Dr. Irisari and Dr. Walker.
Yeah, and I just joining the rest of the panel on this same approach, and especially Dr. Manasov mentioned this, I think is all of our responsibility to take care of this issue. I believe that, these young kids are going to be our future. They'll be here one day sitting and being experts in a panel, and we have to assure that. And so as part of that process, I actually have committed myself to this mission, and I'm going to be in April the 21st. I'm going to be meeting with all the seniors from McAllen ISD and the juniors from McAllen ISD, I believe is a group of 1,000 students. And I'm going to be talking to them about this poison that we're referring to, and I'm hoping that I'll get them to stay away from it. So.
I kind of just want to close my part off, at least following along with Dr. Manasov and also Chief Guerra. This is something that we're all going to have to do together. At the same time, it always needs to start at home. The very first teachers that we have are in the home. Not the schools, not law enforcement, not government. The very first teachers that you have is at home. And like the sheriff said, parents being parents. Just to throw some numbers at you, families that eat together, which is something that I don't think happens a whole lot anymore. Now there's a TV that is on when we eat, and everybody has TV trays or is eating in their own rooms. Or is on their phones. That was talked about a little bit earlier as far as technology. A family that breaks bread together is 40% less likely to stray away from the teachings of the family. Within that, anybody that is suffering from substance abuse disorder, that has support, and where their families are involved in their treatment or involved in their counseling, and forms a support group, that person is 80% more likely to succeed. Thank you.
Representative Munoz?
I just want to add that definitely we're here to help and to assist in finding the solutions to the challenges that we have before us. And I know we mentioned a lot, not only on looking at either creating or amending civil or criminal statutes to address the problem, but I think even from a state perspective, we have to look more at mental health, at the true core of some of the substance abuse, and that is maybe addressing a lot of those issues with our children, whether it's depression, anxiety, self-esteem issues that they're dealing with, but also working to see how we can be more of an assistance in not only bringing those resources, but working with our community to do so. And as Dr. Lopez mentioned, we need to be more proactive in trying to address it. So I just want to offer the help of myself and my office to do so. So thank you very much for having me, and God bless you. Thank you.
Well, that brings us to a conclusion of our program. I want to thank all of the panelists for your time and for your input. I would invite all of you to step over into the cafeteria as we dismiss to learn more from the individual service providers. If you are not a member of Futuro McAllen and you appreciated what we put together here tonight, I would encourage you to stop by the tables at the back and join. It is only through the contributions of the members of Futuro McAllen that funds these programs, so we thank all of our members, and we'd ask you to consider joining. And with that, Nedra, do you have anything to add? Next month we have a candidate forum for the candidates for Congressional District 15, as well as for the one runoff for the judicial position. That will be at the end of April at the McAllen Public Library. We invite you out for that as well.
Thank you all for being here and learning more so we can help our kids. And thank you to all the panelists and to you, David. Thank you.